Hi, Jim Jefferies, the Hoot Owl with Big Country 99.5, and you've heard his commercials on the radio, and now you get a chance to meet him personally, Dr. James Webb. Hey, Dr. Webb. Dr. Webb, why don't you tell people a little bit about yourself?
Well, I grew up out in Kellyville, Oklahoma. You know where
Did
that
you
is.
really?
Yeah, you guys have a ton of listeners out there.
Oh, we sure do, yeah.
Yeah, we're always tuning in. And went to Kellyville High School. I did college in Shawnee at Oklahoma Baptist, and then medical school and everything at OU.
Wow.
So I kind of was lucky to be able to do all my training in Oklahoma, and then I moved back here to Tulsa, opened the practice, and focused mostly on osteoporosis, bone health, and helping people avoid like spinal surgery and
Well, sure.
chronic pain patients. So.
And that chronic pain is important because a lot of people suffer from that, don't they?
Absolutely, yeah. It's an epidemic, and patients and doctors are kind of crushed between a lot of issues with, not wanting to prescribe potentially addictive medications,
Right.
and all of the problems that can come with complications of that stuff. So,
And Dr. Webb, one of the things with today's over-the-counter medications have caused a lot of problems with osteoporosis, hasn't it? Or causing it.
yeah, I mean, we're kind of the first generation that's had over-the-counter inhaled steroids, and even in medical school, we knew when I was back in medical school, we knew that steroids were kind of hard on your bones and can cause osteoporosis. But in the last 4 to 5 years, there's been some major studies that have shown that certain medications like acid blockers, like the classic purple pill.
Oh, yeah. Yeah,
And-
we've all heard that, haven't we?
Yeah, and like the anti-anxiety, anti-depression medication, a lot of people are on that class, SSRIs, which would be like, different medications. Those can all cause, and they may be worse than steroids.
Really?
Yeah.
Wow. So, and those are prescribed a lot these days.
Absolutely, yeah. And a lot of times they're kind of a necessary evil. I mean, they're bad on the bones, but for whatever reason, patients, for example, patients may end up, if they weren't on an acid blocker, they might have really bad GI symptoms like an ulcer and things like that, and people die from that.
Yeah.
So a lot of times those are necessary, but unfortunately, longer term, those may be really impacting bone health in a bad way.
And we are into Osteoporosis Awareness Month here, and this is obviously a time that people really need to be aware of that kind of thing, osteoporosis.
Right, yeah. I mean, most people that we see in the clinic that find out that they have osteoporosis, they're surprised. First of all, osteoporosis is a really long word, and it's kind of hard to say, and it's like we get it in our minds. It's something that, my grandma might have had. Or
Something like Hippocrates or something like that, right?
Yeah, and exactly. It's
Yeah.
a big, the $20 word. So
Yeah.
I like to use bone health to talk about, whether they've got good or bad bone health. It's a little bit more understandable. And the bone density test that we do kind of measures bone density, and that's one measure of bone health, but it's not the only one.
And that's why people, as they get older, if their bone density is less, that causes fractures, breakage, and stuff like that, right?
Right, and that's the most common type of fracture, probably 750,000 vertebral fractures a year from that type of osteoporosis. And that's what I tend to call, little old lady osteoporosis, because in the public mind and even in doctors, unfortunately, kind of get stuck on that vision of, a elderly lady in a nursing home that gets these fractures. But we see it in patients 60 and older, and there's another kind of osteoporosis, like the kind that's caused from other medications or vitamin D deficiency or low testosterone or whatever, called secondary, meaning it's secondary, it's caused secondary to something else. And we see that in patients as young as their 30s sometimes. So,
Wow, that's amazing.
yeah, I mean, I had a patient that was 24 that had that really severely.
So you don't have to be old to have osteoporosis then?
No.
Or some form of it anyway?
No, but it's way more common in patients over 40.
Yeah.
But if you can identify factors that might be impacting your bone health at a younger age, then you can take steps to reverse those. So, like most commonly being like low vitamin D,
Sure,
or
sure.
Other issues like that. Stopping smoking. I mean, we're always talking about smoking, but that's probably one of the worst things for bone health.
Now, what can people do about osteoporosis? They come to your clinic, you can get a scan.
Yeah.
Take us through the process.
Yeah, so what we're doing this month for part of Osteoporosis Awareness Month is we're offering a $75 DEXA, which is, those typically cost about $300. I think it's the national average. And so most patients, if they've got insurance, it's probably not going to be out of pocket to them. And also, if somebody can't really afford that can't afford the $75, then we're going to do it for free anyway.
Oh, that's cool. That's very cool.
Yeah, just for this month to try to get get as many people screened, just to kind of know, so they have an idea what their bone health is. And so, if a patient came in just for that, even they'll come in. Well, went through the process today.
Yeah,
right?
I did. Can't wait to see my results here in just a few minutes.
Yeah, we'll talk about that. So they can come in just for a screening bone density test, and then we'll get the results to them and let them know it's, you kind of are laying on a table for just a couple minutes. And
Yeah, I did. I did that, and it was painless.
yeah,
Kind of relaxing, actually.
yeah, exactly.
So now, why don't you tell the people who are watching this on the website right now how to get a hold of you, and the phone number and where you're located, sir.
Sure. Well, the best way to get a hold of me is my mom, but I'm not going to give her number out. But no, you can call us at 918-260-9322, which is 260-WEB, on the web at drjameswebb.com. That's 2 B's. Or by our Facebook page, you can message us too.
And you're just east of 71st and Sheridan, real easy to get to here.